All right, good evening, everyone. Would like to call this meeting at the West Dallas West Milwaukee School District to order, please. If we could please rise for the pledge. Mrs. Justin, would you be able to lead us, please?
I pledge
allegiance
to
to
the
the flag
of the United States of America,
to the republic
and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, everyone. All right, Suzanne, if we could do the roll, please.
Yes. Mr. Schultz. Mr. Eustrek.
Here.
Mrs. Kaiser.
Here.
Mr. Keller.
Here.
Ms. Klug.
Here.
Mrs. Justin.
Here.
Mr. Sikich.
Present.
Mr. Lee.
Here.
And President Emmons.
Here. Proper notice of this meeting has been posted in accordance with the open meeting laws of the state of Wisconsin. Do we have any changes or modifications to tonight's agenda, Dr. Lexman?
Yes, sorry, I had to unmute myself. Yes, we'd like to move item 10.2 up in the action item section. That's really a courtesy for Jeff Thompson. They have a birthday to celebrate at home this evening.
All right, we'll move item 10.2 to item 10.1, move item 10.1 to 10.2.
Thank you.
All right, we'll move on to item 6 this evening then, our public comments. As a reminder, for public comments, you have up to 3 minutes to address the board. We don't debate or respond during public comments, but rather a response will be sent to you before the next board meeting. If you do want to address the board during public comments, please state your name and address for our record. Are there any people here this evening who would like to make public comments? Just unmute and.
Yes, I would like to make a comment.
Okay, if you could just state your name and address then for the record, and then you'll have about 3 minutes to go ahead and address everyone.
Hi, my name is Janae Morgan. My address is 7837 North 60th, Unit B, Milwaukee, Wisconsin, 53223. Both of my children, Zimri and Zion Johnson, has been in the West Dallas, West Milwaukee School District all of their lives since they have been 4 and 5 years old. My daughter, who is currently in 7th grade, was unable to keep her seat to go to Lane Intermediate Middle School because of the non-available spots for, I'm guessing, people from outside of the district to be able to have the spots in the school. So I am talking on behalf of her because she's been going to West Dallas, West Milwaukee School District. That's all she's known all of her life. She is a minority student, and I just want her to receive the same education that she has been receiving all of her life.
Thank you very much. We appreciate your feedback and your comments. Are there any other public comments this evening? Okay, seeing none, then we'll move on to item 7, the superintendent's report. Dr. Lexman.
Great, thank you. We're going to start with 7.1, and what I'm doing now for each of our regular board meetings, so twice a month, doing an update on our returning to school plan. And Caitlin has agreed to share a screen and put the short presentation up for everybody to see, and then I'll walk through the presentation. So Caitlin, if you want to go ahead and do that. Perfect. Thanks, Caitlin. So this is our update for the September 28th board meeting. So go ahead. So we'll touch, like we did on last time, on where we are with our health metrics. And again, our plan in moving through our phases is based on improvements in health metrics that have been supported by our local health departments. We're going to do a little bit of update on the employee and parent surveys that are running right now, and that's gathering some feedback. And this is with our work with Studer Education. It's a little bit of feedback on how things are going from an employee perspective right now and a parent perspective. A little different than what we've done in the past, but we're in a very different place than in the past. Then we'll take I'll do a little discussion on something we're working on, which is really internal metrics and a dashboard, and something that most area school districts are doing. Then I'll touch again on our distance learning preparation, which is our next phase. That includes phases 2 and 3 of our plan, and then next steps. So you can go ahead. In terms of health metrics, so this has been updated, and unfortunately things are not improving as much as we would hope right now. The last time we looked at this a couple weeks ago, things were trending down or even. And when we looked at Milwaukee County and then West Allis, West Milwaukee, and again, it's COVID burden status that we're tracking. And we want to get the COVID burden status below 100 for both Milwaukee County data and for metric 2, which is the West Allis, West Milwaukee data. And then it looks like we're pretty consistent in the 14-day care trend that's been green all along. So all 3 metrics in yellow or green in order to move to phase 2. So the Milwaukee County data has been moving up recently. We have done a little bit of adjustment in the, so you'll notice an asterisk on September 23rd. And if you go to the main document, there's an explanation of that. But essentially, it's a shift in kind of how the positive test results that accumulate into the COVID burden status are reported and when. And so the little change here actually makes the comparison between Milwaukee County and West Milwaukee apples to apples. And what we have prior to September 23rd is they're really reporting in different ways. So we weren't really able to do a comparison. We're hoping to get the data going back, and we'll update that if we're able to get that data. But what we're reporting now for September 23rd is actually an apples to apples comparison. So I think it's cleaner for us to look at. And Noah, I want to thank you for doing the background work to have the conversation with our health department and then to help me understand that. So if you want to take a look at just a deeper explanation, it's in our linked through our website on our returning to school guide. So you can go ahead, Caitlin. So we're doing employee and parent surveys. And so these are the questions for the employee check-in, and we're calling it a check-in because we intend to do this. We're about 30 days into the school year. We're going to do it again at 60 and 90. And getting sense of how we're doing in this school year. So creating a safe work and learning environment, aware of what's occurring in our school system to meet the challenges, involved with providing input, confident that our school system will overcome these challenges. And then of course, the last one is always any additional feedback on how we can be helpful to employees. And so that survey is running right now. These are quick turnaround surveys. So they're not like we've done in the past with the employee engagement survey where it runs for several weeks. This is a pretty small window and we get the results immediately, unlike in the past where we were waiting for Studer to produce the results, because they always produce employee engagements results and parent satisfaction results compared to other partner school districts. We won't have that information. We'll just have our own internal kind of check-in information. So you want to go ahead to the parent survey. So here are the questions. There's a few more on the parent side. I'm confident my child's school is handling the COVID-19 challenge. I'm confident the school is focused on social emotional well-being of my child. I have the resources I need to help my children learn, and that's an important one for us because we worked really hard to distribute devices, and for families that need hotspots or even more than one hotspot, to try to be as accommodating as possible. Question 4, I have access to my child's teachers when I need them. I receive feedback from my child's teachers, and this is a question that's consistent with parent satisfaction surveys, and there we actually ask the question in 2 directions. I receive feedback around my child's strengths, and I receive feedback on areas where my child can grow. And here we're just kind of putting it together about their learning progress. Then I'm confident that my child will not fall behind in school. And that's also a really important one for us to get a pulse on how parents are experiencing that sense of is my child keeping up? Timely communication, again, similar to the employee survey. And then again, the last question, any additional feedback and how we can be helpful to you and your child. So for employees and parents that are listening this evening or maybe access the meeting later, we very much encourage you to participate in these surveys. And then in the next update, in the first regular board meeting in October, I'll share the results. So you can go ahead. So again, I just want to touch on learning expectations on Wednesdays, and this actually was part of public comment from September 14th. So there was a sense and maybe some belief that, Wednesday is an additional kind of a day off for teachers, and it's not what it is at all. As we work through virtual learning and even into distance learning, our phase 2 and 3, it is actually a normal, again in quotes, virtual learning day for elementary schools. So the pattern that they have on Mondays and Tuesdays continues Wednesday, Thursday, Friday. And secondary, it's a little different. We call it Check and Connect Day. There's an active link here. We don't need to go to that right now, but it's a document that Beth and the team put together to help really explain this. That is also available on our Returning to School Guide website. So it truly is a day where students are logging in. They have coursework and assignments and projects to participate in, and their teachers are really in a work planning day. So they spend about 2 hours with office hours. So they have an open Zoom and students can come and go. So to connect, get help, ask questions. Then we ask teachers to spend about 2 hours really contacting struggling or disengaged students. Maybe they're students they haven't seen in a few days. So we provide some time for teachers to reach out and to see if we can get kids back engaged. Then they, as they can, they start contacting all of their students, kind of monthly rotating, just kind of working through and doing kind of on the personal connects, because so much of what happens with good teaching, good instruction is the informal connects with students. And I remember even as a high school teacher, how important it was when I'm walking through the hallways, when I see some of the students I know I'm going to see later that day in hour 7, to say hi, to connect, to say, did you finish your homework for class today? And so it's those informal things that we try to weave in on Wednesdays. And then also on Wednesday afternoons, for most of our teachers, about 4 hours where they have additional time to plan for instruction, because our secondary teachers are engaging all of students, both virtual and distance learning. So again, just a little update on Wednesdays. And then internal metrics dashboard. And there'll be one of these ultimately, and maybe the language changes a little bit between what I'm sharing here and the final version. So there'll be 2 of them, one for students and one for staff, and it's going to track by elementary, middle, and high school. So then I'll just use students, for example. So in elementary school, what's the count of current positive cases? And then what's the count of what we call close contacts? So elementary students that have been told to quarantine. And so that's after contact tracing that'll be done by our school nurses. That data will be shared with the health department, and then we'll get direction from the health department about who then should quarantine. And then also who's being monitored. So we're calling that low risk. So groups that don't necessarily need to quarantine, but they've been informed that there's been some level of exposure and to monitor any kind of symptoms. And what we're hoping this helps us with, especially as we move towards distance learning, we get an internal sense of, okay, so is there COVID activity in our school communities? And if so, how much? And if it's low, that may help us move towards distance learning more quickly. So it may become a new health metric that gets added to our overall health metric dashboard. It also will help us once we are in distance and even in-person learning, when we get kids back 4 and 5 days a week, to tell us how we're doing. And is there a need or a coming need to potentially have to start closing classrooms or even schools? If you're watching statewide news about what's happening, there's a lot of kind of openings and closings of schools, and it's often based on these kind of data points. And so our school nurses are helping with this. They do already have a Google document in the background that starts to collect some of this. It's now just figuring out how we translate it in a simple way and then the best way to communicate it. So I just wanted to share that as part of our ongoing work. And then in our distance learning preparation, I spent quite a bit of time on this 2 weeks ago. So again, our final preparations are taking place. It's again signage and hallway markers, plexiglass dividers. We have finished, or almost finished, our one-on-one meetings with each school to go through their plan. Today was the 2 large comprehensive high schools. And then in a little more detail here, we are hiring health monitors. Many school districts are bringing in a similar kind of position to help with, if we have students that need isolation, to help with any kind of contact tracing, if school nurses need some support. Currently, all morning positions have been filled in elementary schools. We're doing this part-time morning and part-time afternoon. So we're really looking for people that maybe already are employed and would like some additional hours to help support this work. Jeff Thompson and the team are finalizing afternoon positions. The elementary positions that have been offered, they actually begin October 1st. And even though we're still in virtual learning, we wanted to get them on board, get them familiar with the schools, get them familiar with our health rooms where we will isolate students if they need to be. And then we've reposted for secondary schools, and we're taking a little broader approach to see if we maybe can attract either students in CNA programs or just finishing them. Also potentially home care workers or care workers in retirement communities that maybe would pick up additional hours, and they come with a little bit of health background that we think would support our work as we bring kids back into buildings. And then finally, next steps. So go ahead, Caitlin. So we're entering all the learning choice verification phone survey into Skyward, and those phone calls were made last week. So I want to take a moment here to thank all of the teachers, either the kind of core grade level teacher in elementary schools or home-based or homeroom teachers in our high schools. We made an attempt to reach every single family by phone, and sometimes it was text or email, depending on if we were leaving voice messages. But I think teachers did an amazing job. It was new work for teachers, asking them to kind of cold call families with a short survey. So I really appreciate the outreach. I did get some really nice positive email from parents appreciating the personal touch. And so we'll be entering the data from that outreach effort into Skyward. And it really clarifies, are families going to have their students stay with all virtual learning, or are they coming back for distance learning when we announce phases 2 and 3? And again, I touched on finalizing those plans for each school. We'll finalize our internal metrics dashboard and then review that with our health department. And then we're planning right now for theater and other after school activities. Again, we'll be reviewing that plan with the West Allis Health Department, and then we'd like to get that started. And again, our theory here has been taking small steps as we lead to bringing kids back into buildings for full days. So we think it's one more kind of step towards that ultimate effort of getting kids back in school. And then just a quick reminder here, Wednesday, October 7th, 2020, that is an elementary planning day that was already in the calendar before. We were closed for due to COVID-19. So we have 3 additional elementary planning days built into the calendar this year, and that's one of the days. So I just thought, while people are watching or listening, just to remind folks that there won't be a normal kind of Wednesday instructional day. It's a planning day for teachers. So that's it, Caitlin, you can stop sharing there. And with that, I will go on to, I'm gonna move my screen around a little bit here. 7.2, the legislative update. Sorry, I have to go back to the agenda. Okay, in the legislative update, been a little bit of activity, and most folks are well aware of this, that Governor Evers declared a new public health emergency in response to the surge in COVID-19 cases in Wisconsin. And we're even seeing a little bit of that surge in the metrics we're tracking. It's called Executive Order 90. It proclaims a public health emergency and designates the Department of Health Services as the lead agency to respond, and authorizes the Adjutant General to activate the Wisconsin National Guard as necessary to assist in response. And it directs all state agencies to assist as appropriate in the ongoing response to the emergency. So this emergency shall remain in effect for 60 days or until revoked by the governor or by a joint resolution of the legislature. It continues with a new face covering order effective immediately. And I'm not going to go through all of the requirements there of when we should and must be wearing face coverings. But we've aligned our internal face covering requirement with the governor's orders, both the previous and the new order. And so they're below there in the box. If you're looking at the document, as our face covering requirement, it's all student staff are required to wear face coverings in schools and on buses. And so we're currently, we have inventory to provide when students do come back to school, each staff member and student with 2 masks, clear face shields for students and teachers when it's necessary. We also have gallons and gallons of hand sanitizer on hand, ready to go, sanitizing stations that have already been put out in schools. The one note here is if an employee is alone in a classroom or an office with the door closed, they can remove the face covering consistent with the governor's order is described in the bullets above. And as I've kind of visited schools and we have teachers teaching from classrooms, I think it's very helpful that they're able to remove their mask. There's no one else in the classroom. Their classroom door is closed, so I'm peeking through windows. But they're able to then not have to have a mask on during virtual instruction, and I think that's been helpful for them. So with that, I will go to 7.3, which is the district recognitions for this meeting. And we want to start with condolences to the family of James E. Dotke. He passed away on September 6th at the age of 89. Mr. Dotke grew up in Oshkosh, Wisconsin, where he attended school, including earning a BS in secondary education from Wisconsin State College at Oshkosh. He also received an MS in physical education from Indiana University and a certificate in mathematics for teachers from Wayne State University. So he was his memorial makes me really interested in somebody who could teach secondary education, physical education, and math. Someone we would love to have join us nowadays. So Mr. Dotke spent over 35 years teaching, coaching, serving as an athletic director and principal at West Allis Central High School. He worked tirelessly to support school integration, students who needed an alternative education, and Title IX rights for girls' sports. He is the namesake of James E. Dotke High School, where his legacy of making sure all students succeed lives on. So we thank Mr. Dotke for his service and condolences to his family. At West Milwaukee Intermediate School, the leadership team would like to thank and recognize their new innovation coach, Rob Techmeyer, for distributing Chromebooks and hotspots to students. He also conducted professional development for the teaching staff. He was able to assist with Schoology by producing step-by-step user videos. Mr. Techmeyer has also been on call providing troubleshooting assistance for students, families, and staff. So we're proud that Rob has joined the staff there at West Milwaukee. And then from Leadership and Learning, a little note here, to save costs and increase efficiency, Andrea Watkins and Chris Gostomski and Tody Carpenter consolidated school supply orders. And so why that matters is school supply orders are typically done individually by schools. Things that have to be barcoded and included in inventory come through the district office. Then they have to go back out to schools. And so they created a system that was a massive task of then ordering things in mass. So consolidating all of the orders and then working through the process of getting them distributed back out to school. So it was more efficient for schools to have this organized this way. So we wanted to thank the team there. And then going on to 7.4, which is just some quick information items and updates from me. So I responded in my returning to school update on the perceptions of what Wednesdays are for, both in virtual learning and distance learning. And that was a public comment from the 14th of September. Other quick pieces, like I mentioned, we completed school by school meetings. So today was Central and Hale. So there's just one more meeting left to finalize plans for distance learning. So that when it is time for us to announce phase 2 and ultimately phase 3, we will be ready to go. We're doing a meeting with district staff on Thursday of this week. That's really for the 1205 building and folks at 9333 or other locations, just to connect with them again and update on where we are with our COVID preparations and other items in our strategic plan. It's something that we would typically do at this time of year. We've been racing so much on the school side. We thought we need to kind of loop back to that part of the organization and make sure we all stay connected. Then this week, we're also beginning what is a normal part of a school year, which is working on and reviewing school improvement plans. And so our strategic plan cascades through the high-level 5-year goals to annual school goals. And we call the school goals their school improvement plan. And so getting this kind of tied together and aligned is an important part of our work. And it feels good to be doing some of the normal work of a school year. And so that will begin this week. And then finally, we have purchased and we're issuing district Zoom accounts to every staff member that uses Zoom and every student. And this is really to provide more security. So it creates a more secure environment in Zoom. And we've all seen media accounts of Zoom classrooms getting hacked or Zoom bombed, as sometimes it's referred to in the media. We have not had huge issues with this, a couple reports of it that have been handled well, but we thought it was important to take the necessary step to purchase these accounts, and then those are being distributed now. And I want to thank Brendan Kelly for really organizing that. And I saw the communication that is going out. It's just a step-by-step process of how you access your new district issued Zoom account so that our learning environment is a little more secure. So with those items and updates, that concludes the superintendent's report.
Dr. Luxman,
Yes.
I'm sorry, I had one question. I didn't flag you down before. Just regarding the mask mandate from the governor, you had mentioned that it mirrored ours, but the governor's is 5 years and older, and ours is for all students, so that would include 4-year-olds as well. Is that correct?
That's correct. That's a good catch, Noah. So thank you for that. Yes, every student that's in a building, we have to comply with the governor's order, but local jurisdictions can go beyond it. And so that's a little bit where our board has gone beyond the requirements of the governor's order.
Okay, thank you.
Thank you, Dr. Luxman. Move on to item 8 this evening, the board president's report, taking a look at the board calendar. So today, September 28th, a regular Board of Education meeting. Monday, October 12th, starting at 6 p.m., we have a regular Board of Education meeting, and immediately following, we have a financial stability and efficiency workshop on debt refinancing. On Monday, October 19th at 6 p.m., we have a workshop on our equity plan. On Monday, October 26th at 6 p.m., we have a regular Board of Education meeting, including our final budget and tax levy. Any board members have any events or updates? All right, we'll move on then to our consent agenda for the evening. There are 4 items. Item 9.1 is the approval of minutes from our last education meeting. Item 9.2 is the employment summary. Item 9.3 are our supplementary contracts, and item 9.4 is the financial summary. Does anyone need anything separated? If not, then we look for a motion.
So moved.
Second.
Moved and seconded. Any additional comments or questions? None. All those in favor say aye.
Aye.
Opposed? All right, it's passed. Great, thank you. All right, we'll move on to our action items for this evening. Our new item 10.1 is the Title IX board policies. Mr. Thompson, if you want to begin.
Thank you very much, and thank you for allowing me to speak a little earlier than planned on the agenda. I truly appreciate it. Just recapping, last week, Monday, we had a board workshop on the new Title IX sexual harassment kind of regulations that went into effect on August 14th. And so we did a workshop and we kind of highlighted the main features of it just for kind of a general understanding. Tonight, the board is being asked to approve the board policies related to personnel and students. And so that would be specifically policy 512.1 and 512.1R for personnel, and for students 411.3 and 411.3R. These new policy recommendations are directly related to the new federal regulations under Title IX. And by adopting these policies, it will put our district in compliance with the mandatory expectations.
Any questions for Mr. Thompson? Again, this is first reading, so this would come back to the board on the 12th for final approval. Any questions or comments on the policies and the rules? If not, we'd look for a motion.
So moved.
Second.
Moved and seconded. Any final questions or comments? All right, all those in favor say aye.
Aye.
Opposed? All right, let's pass. Thank you very much for all the work on this and bringing that forward to us, Mr. Thompson. Enjoy the rest of the evening. Fun festivities. All right, item 10.2 this evening then are the additional open enrollment seats for 2020 and 2021. Mr. Norris.
Good evening, everyone. I appreciate you having me here this evening. I wanted to speak a little bit about opening up some additional open enrollment seats. So we typically come to the school board in August to look at opening up additional seats for seniors is typically our typical process, but given our enrollment, I've been working with the members of administration, our enrollment team in the school services department, and also with Dr. Lexman as well. So before you, action item 10.2 is to open up additional seats per DPI law. I've been in contact with Jennifer Demeraux, who is the consultant for open enrollment at the state level. We're unable to open up seats after we have opened up seats after the first Monday in June. We're unable to open up additional seats for in grades which no seats were open at one time prior to the third Friday count September. Given that the count was on the 18th, I thought it would be appropriate to bring this as soon as possible for your review and action. So I have conducted the same process that I would use for open enrollment calculations to filter the 92 percentile. And one note I want to give is that in many of the grades in which you see zeros next to the additional seats, it's because we still have open seats open in those grades. And so there isn't a need to open up additional seats there. Other than that, that really is the summary of the 38 seats. And yeah, open for questions or comments. Yes.
Yeah, if I could jump in here, one thing I just want to make clear for the board and the public that's listening. So the students we would then add, if the board approves this, are not students that we would be able to include in third Friday count, obviously, because it's already happened. So we wouldn't get additional revenue by opening more seats. But given the enrollment dynamics as a result of COVID and all across the state, our enrollment is down. And so we certainly are staffed in a way that it won't cost us anymore to add more students now, even though we don't get the revenue for those students. And then if we're able to fill some of these seats, and we may not fill all of them, but if we are able to fill them, then these students are with us for the January count, and hopefully going forward, then they would be in the third Friday count next year. So we think it is a smart move, both in terms of maybe meeting some needs of families, but also the longer range kind of fiscal picture of managing our enrollment dynamics.
Yeah, thank you for that, Dr. Lexman. I failed to mention that for the revenue piece. Yeah, with the students, as Dr. Lexman mentioned, wouldn't count in membership, but the moment that a student that is open enrolled accepts a seat, we are provided back payment for the number of days in which they are enrolled. So that we would get something in lieu of nothing, which would be good, you know. And then yeah.
No.
Just a few questions. First, mentioning that the enrollment is down and we hadn't had these seats open originally. If these seats, which are maybe now out because of decisions being made regarding virtual learning, once we go back to in-person instruction and things become hopefully more normal, at least by next school year, because once we offer these seats, we're guaranteeing a slot all the way up through graduation for these students. Would there be any concern about stressing these grade levels, which didn't have seats open previously, if, say there's in-district parents who decide to return to our district next year when we're maybe standard in person, now that we've offered these slots up?
Yeah, that's a great question. And that's part of the calculation each year. So if, let's say we had all 38 slots get filled, then in the 21-22 calculation, essentially we would be offering less seats then. We wouldn't go beyond to add additional staff in a typical year to accommodate more students. We staff up to that number, and that's the number of seats we fill.
Okay, thank you. Follow-up question, do we know what districts these students might be coming from? Because we hear often after third Friday count, there's now students that get booted out of, say, private schools that would come to our school. Do we have any data on that? I know I've asked this question before, to see what percentage of these students are coming from a private school versus another public district.
At this time, I don't have any data to support or add on where the students are coming from, private or public. It's certainly something that I could pull as we get closer to January to provide a holistic, I guess, view of what students were accepting, what private schools, parochial schools, et cetera, if you'd like.
So we could see at least where they, at least right now, were enrolled before coming here if they accept a seat here.
Yeah.
Okay. Thank you.
Any other questions? All right, then we would look for a motion.
Move to approve.
Second.
Second.
Moved and seconded. Any final questions or comments? All right, all those in favor say aye.
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 Opposed? Great. All right, thank you, Mr. Norris, for helping to get kids enrolled in our district.
Yeah, thank you.
All right, item 10.3, the 2021 retiree prescription plan, Ms. Windler.
Hi, everybody. Thanks for having us. I'm here tonight too with Jessica Johnson, who is our benefit specialist. So we'll be walking through our retiree prescription plan renewal. So I will share my screen again. Oops, not share, present. Okay. So this is for the 2021 calendar year, and this is for our retiree plan only. This is not the active plan. So what that means is we have our active participants on an insurance plan WEA, which is separate from what we're going to talk through here tonight. So a month ago, we walked through our active plan renewal with WEA and included a specialty tier, a new tier for specialty drugs, which was 20% of the copay for a maximum fill cost of $250 for that specialty tier. So as we were working with our broker for our retiree prescription plan renewal, which is with Humana, we asked them to mirror what the plan would look like for retirees with that same copay, and then also give us a scaled back version, which would be less burdensome on retirees. We know retirees are often on fixed income, so we wanted to see what both of those options would look like. And throughout the presentation, you'll see RX, which is just shorthand for prescription. So some data on the plan. We have our participants who are on the plan must be 65 years or older, and the same age group also has the ability to go on Medicare Part D. So this will sort of refer to it as an optional plan for those people who are eligible. And there are 732 retirees or retired employees or spouses that participate in the prescription plan at this time. And our district spends annually about $600,000 on our share of the retiree prescription plan. So on most of our benefit packages, the retiree and our district split 50-50 the cost. So a little bit of information on what our current tiers look like. So the difference of these two screenshots is this one is a 30-day supply on the left, and on the right we have a 90-day supply. So you'll see that we have tiers 1, 2, 3, and 4. Our current tiers are $10, $20, and $30, and our tiers 3 and 4 are the same. And that fourth tier is what our specialty tier would or is. And right now our specialty tier is the same as our tier 3. And the difference from this top one and the bottom one is these top numbers are for retail and the bottom is for mail. So this is some pretty interesting data on the cost of the plan. So what does it cost us when a retiree fills a prescription that's a tier 1 prescription versus a tier 4 prescription? So this spread is a way that we put that data into numbers. So for each tier 1 prescription filled, which is essentially the cheapest prescription, the spread is $7.26. So what that means is the plan pays $18.49 and the member pays $11.23, which is a pretty close spread. But as we go up and the drugs get more expensive, the spread becomes bigger. So for that tier 4 specialty prescription, the spread is over $6,000. So what that looks like is the plan pays $6,098.56 for that tier 4 drug, and the member only pays $29.71. So while our tier 4 represents 1.2% of our total prescriptions, it accounts for almost half of our total cost of this prescription drug plan. So information on our plan design history. This plan actually hasn't changed since 2010. And in 2010, what happened is our copays actually went down. So our plan was $10, $20, and $35 for tier 1, tier 2, and tier 3 and 4. And in 2010, it actually decreased to $10, $20, and $30, which we just looked at in that last graphic. And I believe this was also the last time that this plan came to the board because it was the last time a plan design change happened. So looking at what the cost is, I gotta move you guys to the bottom of my screen. So our current 2020 monthly premium cost is $145.37, which again, in most of our benefit packages, the retiree and our district splits that cost 50-50. For our 2021 monthly premium base cost, we're calling the base cost the plan renewal without a plan change. So if we made no changes, the plan premium would be $157.87 per month. And with that specialty tier of $100, we would see a decreased premium from what the base renewal would be to $148.74 per month. So it would be still an increase from our current monthly premiums, but it would be a decrease if we made no plan design changes whatsoever. So, and I wanted to mention too, when we inquired with the broker about what the $250 specialty tier copay would look like in terms of premiums, it was an even more decreased cost. So it was actually down from where we currently are. But that premium, that difference from what they currently pay of that $30 to the $250, we thought that scaled back version was more appropriate for our retiree population. So this $100 specialty tier copay is what we'll be recommending tonight. And I'll go through some more information on what the impact is for our retirees when we look at that $100 copay. So participants on the prescription plan would see a decrease in their monthly premiums of about $4.57 from that 2021 renewal cost. So again, it will still increase from this year, but decrease if we made no plan design changes. And that equates to about $55 of savings annually for a retiree. There are 30 unique members, or about 4% of our retiree population on this plan, who currently fill a total of 148 specialty medications, who would realize an increased copay from $30 to that recommended $100 with this plan design change. And that also means that our district would save approximately $35,000 annually, which is because our district and the retiree split the premium 50-50 in most of our prescription, or most of our benefit packages. So looking at that population who utilizes those specialty drugs, that 4% that we talked about in the last slide, what that actually means for what the impact would be on those people in particular. So the largest number of tier 4 or specialty scripts that have been filled in 2020, we have 2 members who filled 9 specialty drug scripts so far in 2020. So what that means is if we were on the new plan right now, those 2 members would have paid each an additional $630 so far through 2020. We also have 5 members who have 8 specialty drug scripts so far in 2020. So what that means is if we were on the new plan right now, those 5 members would have each paid an additional $560. So the math there is just, instead of the $30 copay, they would have paid $100. So it's $70 difference times the number of specialty drug scripts that they have filled so far. So the rationale, again, just to summarize what we talked through here tonight, is that the change to a $100 copay for the tier 4 specialty drugs moves us in the same direction as the recent change from last month that we talked through in the active employee prescription plan. So in the active employee plan, we increased that tier 4 specialty drug copay to $250 as a max. And here tonight, we are recommending the $100 copay, so scaled back a little bit for our retirees based on the nature of being retired and generally being on a fixed income. The plan change also results in expected savings for our district of about $35,000 per year. It lowers the annual premiums for participating retirees by $55 per year. And then continues to be an optional benefit for qualified participants, meaning once you're at that age 65, there is the option for Medicare Part D as well. But I do want to say that this plan is definitely more rich and beneficial for our retirees to participate in than Medicaid Part D, Medicare Part D, but it is an option for the same group of people. So any questions? No, go ahead.
I just want to say that the financial committee has been seeing this presentation, and we were in support of the $100 deductible. And I also wanted to note that I had asked if this was something that most districts had, having people over 65 having their own prescription, and the answer to that question was no. So we are in a minority of districts that are offering this. Most districts will kick people off of their prescription plans once they hit 65 because Medicare Part D exists. So I think that we're still offering something that most districts don't. And we're trying to keep things in line with what we're doing with our active employees. So that's why the committee was in favor of this move.
Thank you for that.
Hear that feedback. Any other comments for Caitlin? Questions?
I'll add one here. So Caitlin, I think this is correct, but if I'm wrong, correct this. But for many of the higher cost medications that fall into the specialty category, often manufacturers have programs to underwrite participant co-pays. And so myself as no, I'm not a retiree. I have one medication I take that falls into that classification. And even under our new plan at $250 a month, I pay zero copay because the manufacturer underwrites all the copays for people that have been prescribed that. And so I think that's true for specialty medications.
Yep.
As someone who is newly in that tier 4 medication range, is this something we can provide education on to our retirees who then, because I'm agonizing about adding $70 to a copay, even if it saves the district a lot. But like Marty just said, is this something that we can say, here are possible program supports, or is it if they opt in versus like Medicare Part D? Can you just explain that a little bit to me?
Yep. So we've been working actually with, we've gotten information from a few different consultants. And so while we are not the experts on Medicare Part D, there are definitely companies who are. So we, Jessica and I have been working with our broker on information that we're able to give out to retirees. And so with this information tonight, and hopefully if we have an approval tonight, we'll be putting together retiree packets for renewals, which will go out in the next week or two. For retiree open enrollment period is November 1 through November 15th. Am I right, Jessica? November 1 through November 15th. Okay, I'm getting the nod. And so we will be able to provide as much information as we can gather in the next few weeks before we put those out in terms of options for our retirees.
Any other questions or comments for Caitlin of the group?
Not a question, but when it comes to a vote, I will need to recuse myself.
Any other questions? Okay, then we would look for a motion.
Move to approve.
Second.
Moved and seconded. We'll have one recusal. Any final comments or questions? Not all those in favor say aye.
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 Opposed? All right, great. Thank you very much. All right, that is the last item on our agenda for the evening. So we would look for a motion to adjourn.
Move to adjourn.
Second.
Moved and seconded. Any additional comments or questions? Anybody else want to keep going? All right. All those in favor say aye.
Aye.
All right, we are adjourned. Thank you, everybody. Take care of yourselves. Be safe.